I'm Karen Wary, Manager of Clinical Performance Excellence for Health Texas Provider Network. Today I'm going to take some time and talk about aseptic technique. Aseptic technique refers to the practice of reducing the incidence of bacteria. We like to remove bacteria from areas before there's any clinical procedures that are done. We do this by cleansing our hands. Cleansing your hands removes the bacteria from the surface of your hands, your fingers, your nails. Has to be done correctly. Most products say you should use at least a quarter size plop of the cleansing on your hands and then let it air dry. It's the air drying that actually helps to kill the bacteria. Another way that we use aseptic technique is when we prepare a patient for a procedure, such as administration of a medication. If you're going to give an injection, you will take an alcohol pad. You start in the middle, you cleanse 2 inches out, and you let it air dry before you give the injection. That is to remove as much bacteria. We can't remove it all, but we can remove a lot of it. And we don't introduce more bacteria to it, so when we give the injection, we're not introducing bacteria into the tissues. Another thing we do in Health Texas to help guarantee that our products, anything we use on a patient, is sterile, is we ask our clinics to follow our policy and procedure for sterilization, which says you will place a peel pack into another peel pack. You will put an indicator into the peel pack with the instrument, date it, and this is good after run through the autoclave properly. It can sit on your shelf for 1 year before it needs to be redone. We also have our wrap packages. Our wrap packages are done the same way. They're wrapped in 2 layers of the product, the paper wrap. We put tape on it. We make sure there's an indicator inside next to the instrument. We run these through the autoclave. Once they're dry and we remove them from the autoclave, we place them into a Ziploc bag, which is really called a dust cover. And once it enters a dust cover, it's airtight, air can't get into it, and it can sit on the shelf for 6 months before it needs to be replaced. One other thing that we do spore testing. We ask the clinics to sign up with a company to do spore testing so that the spores are sent into the company at least once a month, and they let you know if your machine, your autoclave, is working correctly. We also use aseptic technique when we're opening a sterile field to do a simple procedure in the office for a mold removal, any kind of a procedure where your physician wants you to set up a sterile field. You're going to remove the tape. Always be aware of where you set your sterile field up. You don't want to ever put it next to a window or a door or where there's a high traffic area where someone's going to walk through and knock it over, contaminate it. You also need to let your patient know not to touch the sterile field once you have it open. Always remember when you're opening a sterile field that this fabric has a memory to it, and it can always plop back. So be careful when you're opening it. Don't ever lean over a sterile field. Leaning over a sterile field, our skin, our clothing has lint, it has dry skin, it has hair that can fall off and contaminate the pack. So you always want to make sure anything you do, you're going around the sides. 1 inch along all of the sides of this sterile field are considered not sterile. So I can touch the sides, I can maneuver it around. I have my pack open. Now the doctor has told me that he wants another needle on there and a syringe. And when I open these to do it sterilely, I'm not going to reach over and open it right over it. I open these products from the side and you kind of flip them on. And be careful because sometimes they flip right off of your field and have extras in the room. If you should open a product and it falls halfway on and halfway off of your drape, it's considered not sterile. It needs to be removed, and you need to let the surgeon or the physician know that that area right there is no longer sterile, so no one will touch it. Now, I need to remove the gloves because the doctor asked me to set up the field. So I'm going to reach in from the side and pull out the gloves. And I'm going to move them to another area so that I don't contaminate my sterile field. Okay, we're opening the gloves. And again, you're going to do it without touching the inside of the package. Remember, 1 inch around all of the sides are considered not sterile. Now, I'm going to pick this glove up, and I picked it up by touching the inside of the glove. That is all that I have touched. I slip it on. The glove itself is sterile. I'm going to pick this glove up by touching the outside of the glove because I have a sterile glove on it. I slide my hand inside and my gloves are sterile at this point. It's Aseptic Technique. Then the doctor asked me to remove the packaging from here and set things up for him. And I know how he likes it. And once again, 1 inch around the edge of my drape is considered not sterile. Sterile fields should never go below your waist or above your shoulders, so you're always going to keep your hands in this area here. Anything you pull out of the pack, just make sure that it stays within the sterile field. I have my sterile field set up for my doctor now. I can remove my gloves. I'm no longer needing them. Those are considered contaminated, and I can go get my physician at this point. That is how you set up a sterile field using Aseptic Technique. I'm Karen Wary with Health Texas Provider Network.